Okay, now today's topic is thrombosis and embolism from the pathology department. Thrombosis occurs when a thrombus or a blood clot develops in the blood vessels and reduces the flow of the blood to the vessels. On the other hand, the embolism occurs when a piece of blood clot, remember a piece of blood embolism, a piece of blood clot, foreign objects or other bodily substance become stuck in the blood vessels, and largely obstruct the flow of the blood. Okay. Thrombus as the solidification of blood constituents formed within the vascular system during the night. While the hematology is also a blood clot, the solidification of the blood constitute outside the vascular system or after the death. It's outside the hematology or is outside the blood vessels. Okay. Thrombosis is a process of thrombus formations. There are type of thrombosis. There are venous thrombosis and the arterial thrombosis. Venous thrombosis, when the blood clots block the vein, this involves the thrombus developing in a vein. Vein carries a deoxygenated blood from the body back into the heart. For example, deep vein thrombosis and pulmonary embolism. The arterial thrombosis is when the blood clots blocks the artery. Arteries carry oxygen to blood away from the heart to the body. It is MI or myocardial stroke as far as sin is concerned. Cases of arterial thrombosis may be minor or severe depending on the size of the thrombus and the artery in which it develops. The figure shows here the blood cells, the blood vessels, and the clots formation is already there in the blood vessels. This is blood clot or a thrombus, and a piece of blood clot, the piece of blood clot of this portion traveling to the vein. Ali, Ali, see, you are gड़बड़ हो गई. हाँ, ये थोड़ा देखो गड़बड़ हो गई. ठीक है, रिकॉर्डिंग स्टार्ट. Thrombosis risk factors, yeah, inherited risk factors and acquired risk factors. Inherited risk factors involve sometimes genes mutations and the factor five relating deficiencies. On the other hand, the acquired risk factors are cigarette smoking, over contraceptive pills, active infections, and hypocholesterolemia, nephrotic syndrome, and diabetes mellitus. Arterial risk factors are hypocholesterolemia, with smoking, hypertension, complicated stage. Venous risk factors are oral contraceptive, immobilization by diagnosis, surgery, and trauma. The risk factor of venous thrombosis may include family history of the blood clots in the deep vein, history of DVT, hormone therapy or blood control pills, pregnancy, injury to the vein, injury to the vein, lack of movements, and central venous catheter, old age, smoking, being overweight, or a piece of health condition such as cancer and heart disease and lung problems. Risk factor of venous may include family history, history of DVT, hormone therapy, pregnancy, injury to the vein, lack of movements, old age, smoking, and overweight or obese persons. The risk factors of arterial thrombosis are diabetes mellitus, high blood pressure, high cholesterol, lack of lack of activity and obesity, and that is a sedentary life, poor diet, family history, and lack of movements. Porphyria thrombi case of arterial thrombi affect the heart chamber or the aortic lumen are designated as mural thrombi, while the most common site in decreasing order of frequency are the coronary, cerebral, and femoral arteries. Arterial thrombi tends to grow retrograde. Usually occlusive, commonly attached to the anterior artery wall, gray, white, and provide composed of meshwork of platelet, fibrin, erythrocyte, and degenerating leukocytes. In case of venous thrombi extend the direction of the blood flow. Morphology of the thrombosis. The thrombus is a blood clot, and thrombosis is a formation of clot. It reduces the blood flow. Arterial or cardiac thrombi usually begins at the site of endothelial injury, whereas venous thrombosis can usually occur at the site of stasis. Thrombus often have grossly and microscopically apparent lamination or lines of the heart. They are pale platelets and fibrin deposits alternating with darker red cells rich layer. Such lamination signifies that a thrombus has been formed. Thrombus occurring in the heart chamber or in the aortic lumen are designated as mural thrombi. Arterial thrombi are frequently occlusive. The most common site is the decreasing order of the frequent are the capularized cerebral and femoral arteries. Venous thrombosis, level thrombosis, almost invariably occlusive with the thrombus forming a long, long luminal cast. Lines of the hands, they are the characteristic of the body. They have layer with lighter layer of platelets and fibrin and darker layers of red blood cells. These are the fibrin RBC leukocyte, dark red, and the formation of long lines of the fate of thrombosis. The patient survives the initial thrombosis and the initial day, 2 weeks. Thrombosis undergoes some combination of the following events. One, with the lysis. Number two is the propagation. Lysis. Number one is the lysis, period of the thrombosis. The body naturally dissolved by the fibrinolytic mechanisms. Therapeutic administration of the fibrinolytic agents such as TPA, the tissue plasminogen activator, generally effective only when given during the first few hours of thrombotic events. Plasminogen activators leaves the plasminogen into plasmin, which dissolves the clots. Propagation and thrombi accumulate additional platelets and fibrin circle. A vein is completely occluded. Number three is embolisms, where a part of thrombus can detach and travel to the distant side. Number four is the thrombus enlarges and occludes the blood flow to the arteries or veins, depending on the organ that is involved. It may have varying frequency. And finally, we have organization, and occluding thrombus is reorganized. Older thrombi becomes organized by the inorganic older thrombi becomes organized by the ingoing of the endothelial cells, smooth cells, muscle and fibroblasts, capillary channels usually forms and establish the continuity of the original lumens. Continuous recanalization and the process of restoring flow to the rehydrated and uninterrupted channel or bodily tube blood. Continuous recanalizations process of restoring flow to or united the interrupted channel of the bodily tube blood vessels may convert the thrombus into smaller mass of connective tissue that becomes incorporated into the vessel wall. The venous thrombosis, clinical feature venous thrombosis, arterial and cardiac. Venous thrombosis is caused painful congestion in edema distal to an obstruction, but are mainly a person due to their tendency to immobilize to the lungs. Venous thrombosis, most venous thrombosis occurs in superficial or deep vein of the leg. Superficial vein thrombosis typically occurs in the saphenous vein, and the deep vein thrombosis, DVT, involves one of the large leg vein at or above the knee. That is the popliteal femoral iliac veins. DVT may cause local pain, edema due to the venous congestion. The diagram of the DVT showing different sides. Feature of venous thrombosis continue. Lower extremity DVT are often associated with the hypercoagulable state. Common features causing factor include bed rest and immobilization. The trauma, surgery, and burns not only immobilize the patient but also associated with the vascular insights. The tumor-associated inflammations and coagulation factors, tissue factors, factors 8, as well as procoagulant mucin, release the tumor cells, all contribute to the increased risk of the thromboembolism in the disseminated insult. The arterial and the cardiac thrombosis, and the atherosclerosis is the major cause of the thrombosis. Arterial thrombosis because it is associated with the loss of endothelial integrity and with the abnormal blood flow. Another one is the MI, myocardial infarction, the rheumatic heart disease, and both the cardiac and aortic valve thrombi are prone to embolisms. DIC, disseminated intravascular coagulation. Definition: DIC is a rare but serious condition, causes abnormal blood clotting throughout the body and the blood vessels. It is caused by another disease or condition, such as an infection or injury that makes the body normal. Blood clotting process becomes overactive. As I have told you about the DIC, acute, subacute, chronic thromboembolic disorders. This is a picture showing the DIC. General considerations. It is a syndrome characterized by massive activation and consumption of coagulation protein, fibrinolytic protein, and platelets. Pathogenesis. DIC is not a primary disease. It is coagulopathy and it occurs in the course of a variety of clinical conditions. Examples such as placenta and obstetric complications and tissue injured by the trauma or burns. Mucus release from certain adenocarcinoma may also act as a procoagulant by direct activate chapter 10. Pathogenesis, DIC involves the abnormal excessive generation of thrombin and fibrin in the circulating blood. The tissue factor is the primary initiator of the coagulation cascades. The figure shows that the activation intracoagulation and endothelial damage also. When there is activation intravascular coagulation, the platelet consumption, coagulation factor consumption, and fibrolysis occurs. The consumption of the platelet will lead to the decrease in the platelet thrombocytopenia And the coagulation consumption means that increase in the PT-APTT time. The D dimer is also increased, which shows the coagulopathy process is going on. Symptoms and sign symptoms: GI bleeding, pretext hemorrhages, ecchymosis, intravascular lines and catheter surgical sites, renal failure, permanent involvement, and jaundice. Critical feature DICR: when the lungs are involved, there is dyspnea, cyanosis, and respiratory failure, pain or conversion, or this sector of DIC, sepsis, obstructive complication, acute hemolysis, trauma, shock, cancer, and allergic reactions. Types of embolisms: the abdominal embolism, fat and mild embolism, amniotic embolism, thromboembolism, air embolism, septic embolism. Amniotic fluid embolisms and thromboembolisms, air embolism and septic embolism. These are the types of embolism. Infections. The infections are the localized area. The infarct is an area of ischemic necrosis caused by the occlusions of either the arterial supply or the venous drainage. Infarcts are classified according to head, according to the color and the presence of absence of infection. They are either red hemorrhagic or white anemic and maybe red infarcts and in the white anemic infarct. Which affect the lung and other loose organs like testes, the ovaries, and small intestine. Occlusion consists of more than red blood cells and pupil distracted. The white infarct affects the third organ such as spleen, heart, and kidney, wherein the solidity of the tissue substantially limits the amount of nutrients that can flow into the area of skin necrosis. White infarct with the arterial occlusions. The septic infection occurs when the infected cardiac wall vegetation, emboli, or when the macro seeds necrotic tissues. These are white infarct, white microscopy is due to acute inflammatory cells along the margin. Infiltration of macrophages, removal of the necrotic debris in tissues composed of lipid or cells. Generations at the periphery of the infarctive stroma architecture is preserved. Generation tissue formation and maybe repaired by Here's a few pictures. Factors that influence the development of heart are the anatomy of the vascular supply, rate of occlusions, tissue vulnerability to hypoxia, and that is all. Thank you very much. Ali, ये कहाँ से कन्वर्ट कहाँ से होगा?